With that, we will stop and take questions.
So how much of moving up 65-year-olds, Director, how much of moving up 65-year-olds is part of public pressure? It doesn't seem like much more vaccine is coming in based on what you said before. Dr. Chan has said that other states have seen confusion. Why the change? Is it pressure from the Lieutenant Governor, soon-to-be Governor, and others about that age group? What's the difference?
We have wanted all ages to be vaccinated with having the amount that we need. Being able to have the 65 in place allows us to accelerate the timeline, have people start to register earlier, and so that as the vaccine comes through, we are able to get it to them effectively. There isn't any change in course or pressure. It's what we've wanted to do, and it's really a matter of how to help operationalize this so that we can move as effectively as possible.
Is there enough vaccine for that? The claim was made before that there really wasn't.
Yeah, but what we will be doing is allowing for the registration to come so that as the vaccine comes in, it will already be in place and we'll be able to administer.
Dr. Alexander Scott, how would you grade the vaccine program so far the state's running? Do you consider it a success?
I would consider understanding that our team has been thoughtful, has followed the data and the science, and that we are moving as effectively as we can.
What grade would you give it?
I would give it B+, A-.
One other follow-up, how are the flu numbers this year? You talked a lot about that last fall, always worried about that with the hospitalizations. How are the numbers compared to the previous couple of years?
Our flu numbers are holding steady. I want to get back to you on exactly where we are. There certainly is some benefit to the masking that we have in place in terms of stopping spread of respiratory viruses overall, but we can get back to you with exact numbers.
In my circles, I don't know, and I always hear, oh, I got the flu, I was out with it. I have heard of nobody getting the flu, which is good, but I'm wondering how that is in terms of hospitalizations, which is what you're worried about.
Right, right. Yeah, and we're early on in the flu season, relatively so. So we're thankful that our hospital capacity isn't worse, but definitely want to continue to be vigilant for going forward.
I have a question for Governor McKee, if we could have him step up to the podium, please. Governor, next Wednesday, Rhode Island Governor Gina Raimondo is expected, she's going to be voted on out of committee. It could then quickly move to the Senate. If, in fact, next week, Rhode Island Governor Gina Raimondo resigns, you become the governor, are you up to speed time-wise, or were you anticipating that it would be a longer process?
No, it'd be right around that range. I was saying either side, 1 week either side of the middle of the month, so we're right in that area.
Your process for selecting a lieutenant governor, how soon would that take place once you, in fact, become the governor?
Yeah, so it's not a top priority at this point. Obviously, the COVID is the top priority, but I would say that before the end of February.
Lieutenant Governor, are you 100% behind this new phase 2 and the way that the next vaccinations are going to be rolling out, acknowledging that there isn't any prioritization for teachers in it?
Well, first I'd like to say that, you know, I've met with Dr. Nicole Alexander Scott and also the Major General Chris Callahan daily for the last week, and that's been very beneficial, hours of learning on things. So I think that, you know, yes, I think that based on the age, the geography, and the conditions, the health conditions, it makes a great deal of sense. I think that Dr. Scott mentioned how inside of that catch basin there, that 58% of our K through 12 teachers will be reached during that time frame. So I think that information speaks to what I was, saying, that teachers are important to get vaccinated, and over 2/3 of the grades K through 12, which I've been told, and that's data that has come from Dr. Scott in her office.
Are you on the same page with these issues, you and Dr. Scott?
Yes, I think that we want to make sure that the infection rate is reduced, the hospitalization rates are reduced, and the mortality rates are reduced, and going into these age groups, it makes sense.
Dr. Alexander Scott, just to be clear about the process, the registration process, is there a last mile delivery component? In other words, a frozen box of vaccine is open, there's an extra 7 vaccine in that box. Will someone go to that registration list and call people in to wherever that box is located? Or, in other words, the vaccine is getting thrown out or have been complained about going into board members' arms, that whole story.
Yeah.
Is this to remedy that?
There is and will continue to be a robust process to ensure that vaccine is not wasted or thrown out in any way. We are among the states with the lowest discarding rate, 0.2%. And that happens when you take these types of thoughtful approaches. It does mean that sometimes we are, making sure the system is in place and seen to be moving slower than others. But there's a purpose to it in ensuring we're not wasting any and we're getting it into the arms of the individuals that we need to stop hospitalizations and to keep alive. When you move too fast, then there's more of a risk of wasting or not being able to use it. And the current supply does not allow for that right now. So we prefer to make sure that we're thoughtful and cautious in how we go forward effectively.
So the registration is essentially a step forward from where we were the last month and a half as far as getting people to an area as quickly as possible when even 3 shots become available.
Correct.
Dr. Scott, Channel 12 is reporting, they talked to Dr. Fine, and you mentioned that Central Falls is going to be a focus as far as the receiving the vaccine. Now, Dr. Fine also said he thinks that Central Falls could be one of the most infected places maybe in the world. Now, last summer, right here, I would ask you, why was Central Falls being treated the same as Block Island or Jamestown? And you would talk about health equity and inclusiveness. Do you now feel it was a mistake for you to treat places like Central Falls the same as some of these outlying areas?
Interesting question. So if I recall properly, you were asking why are we not kind of targeting those communities and treating them differently as if there was some
because of the outbreak,
components that the individuals themselves contributed to why Central Falls was seeing higher cases. And so my response was to say,
but they did have higher cases.
They did, but
Correct.
Not because of the individuals or the communities there themselves.
But
and
the
so
numbers were the numbers.
I was informing that we are not going to treat communities differently as if they are to blame for the higher cases. We want to really focus on the conditions that contribute to that happening. Higher density, more individuals who are working on the front lines, more multi-generational houses in place. And we have taken the approach of ensuring that we are testing more in those communities, providing housing and other supports in those communities, and helping to ensure that vaccination is adequately available for them so that we can counter the fact that hospitalizations and other rates have been higher in those communities. So I'm comfortable with where we are. There is always room for improvement. We are engaging directly with the municipal leadership in those communities and continuing to push on how we can improve access in those areas.
So with the vaccine, hold on, just with the vaccine, they will be treated differently, correct?
We do have geography as one of the prioritization groups that I have described. And with that, we will be accelerating access to vaccines in those communities that we know are hardest hit given the descriptions that I just gave.
Doctor, can you walk us through, for people who are 65 and older who are hearing this, how are they actually going to get the vaccine? How are they going to sign up? Where are they going to go to get it? Is somebody going to be calling them? How do you ensure that there's no line jumping? Is there going to have to be some kind of proof to do all this? What's the practicality of what happens now when they hear this, and how am I actually going to get the vaccine?
We will be coming back to provide more specific details for each of those. We wanted to make sure people understood the approach that we're going to take, why we're going to take it, how it's based on science and data, and have a sense of the timeline. There isn't anything new someone has to do right now, but as we approach it and in advance of that, we'll be providing details of how to access it, make sure that we're getting at every opportunity for someone to be able to get vaccinated, whether they can drive or if they need to walk somewhere or they have a provider or want to go to the pharmacy. We will be making all of those available and communicating directly with the populations through social media and other mechanisms.
Just to be clear, how much of it is going to be online? I know there's a lot of concern among older folks who are not online, don't have an email address, that they're going to be behind the curve on this.
Yeah, we will be using every mechanism we can. We've already begun to engage with the Office of Healthy Aging, who understands those concerns. How can we go to some of the senior homes? How can we engage in some of the senior centers or make things available in ways that seniors need to do it? That's part of the example of how thoughtful and systematic we've been in the approach, so that up front we can ensure that who needs to access it will be able to.
Why Sunday on the rollout with the restaurants? Why not now? They lose a whole other weekend of business.
We wanted to just give time to be able to understand.
You got restaurants who are like, okay, 10:30. They don't need to like have a seminar to figure it out, right?
It's an appreciated point. We wanted to be able to confirm that the data is continuing to go in the direction that it's going in, let them know in advance. I can certainly give Secretary Pryor an opportunity to add anything more, as we've been communicating with those groups.
If that changes, why not tomorrow, Secretary? Give them another weekend. They've waited, this was supposed to be 2 weeks on a pause, and it's been 2 months. It's thousands of dollars that they're not getting reimbursed for.
It's a fair point. We want to lift restrictions as soon as is feasible. I think it's terrific that we have reached this point where we can roll back the early closure. It has affected an array of business categories. It's not just the restaurants, of course, that have been affected. I just want to actually re-articulate the categories of business that are affected: restaurants, recreation and entertainment, historical and cultural sites, personal services, gyms and fitness centers, and sporting facilities. One of the things that our team has always emphasized is to communicate effectively, and quite frankly, the dialogue inside our team has been about the fact that people still need to exercise caution. They still need to observe all of the pre-existing rules, and the pandemic isn't over. So the health department requested that there be some time for that communication. Also, it's worth noting that there's been a regional dialogue around the curfew, if you will, for shorthand purposes. And Connecticut is still considering what to do with its policy. So we took all those points into account. I will say, from a commerce perspective, we are thrilled that the early closure is ending. And under incoming Governor McKee's leadership, we're in dialogue about additional flexibility that may be possible with other restrictions upon industry, all while monitoring, as Dr. Alexander Scott said, the public health data.
Secretary, you live in a government world, and you have not lost a paycheck. Have you taken a furlough or
No, sir.
And so during the entire, you have restaurants and all those other businesses who could flip the switch tonight. So, government, they sit around and you ponder and you have think groups and they're all on the same team. People are losing thousands of dollars. Flip the switch tomorrow.
This is forward progress. So we're very pleased to see that, in fact, we are moving in the right direction to allow for more commercial activity in Rhode Island.
Well, you mentioned entertainment. How does live entertainment factor into that? Right now, it's almost impossible if you're a music venue or performance space to have any kind of activity. So
Yes.
What changes there, and will that restrict their ability to seek loans or other grant programs if they so choose to remain closed out of their own concerns for safety?
One of the topics that under Governor McKee's leadership with Dr. Alexander Scott at the helm of the dialogue we're discussing is what is the role of testing now that the state-of-the-art technology allows for 15-minute turnaround Binax Now testing. What's the role of ventilation? What's the role of the vaccine in helping us diminish the impact of the the pandemic. You've heard all of that from Dr. Alexander Scott today. In that context, we're thinking about events and gatherings. Entertainment is one of those subcategories. We're thinking about what might be possible. We are not yet ready to make determinations, but I can tell you, as recently as today, Governor McKee and we were talking about what might be possible. There is a good exemplar now, a step forward, in that the event professionals, bless them, have organized themselves. And under Luke Renshin and a group of others who have been working hard at this, we just staged a mock event that incorporates testing so that there's a bubble at the event itself. And we videoed it so that we can, as time goes by, in accordance with the best public health guidance, we can get to the point where we can expand numbers at events and presumably at entertainment with testing as a tool. That moment hasn't arrived yet. We're pleased that the early closure is over. That's the major step for today.
Go back to the vaccine. Can we go back to the vaccine?
A couple questions for the doctor, please. Just curious in terms of practicality, you're saying that 75 and older do not need to do anything as of right now. They will be contacted, correct?
Correct.
And then 65 starts mid-March. At what point can they start signing up?
We will be making that information public with clear details about what's going on in the subsequent week or two.
I think people are going to be watching and they're going to wonder what this looks like, particularly after what happened yesterday in Massachusetts. Are you seeing signing up for vaccines similar to how we sign up for tests through one streamlined service instead of right now for 75, like Warwick, for instance, just opened their own sign up for 75 and older. So are we going to have towns doing different ways, or is it going to be a streamlined service through you all?
We will work that out in the way that is best. I want to bring some of that detail back at a later time, recognizing that our goal is to make this as simple for the individuals and as effective and efficient as possible on our level from a distribution and ultimately administration standpoint, while also ensuring safety. And I can reiterate that's also been part of why the time frame has occurred. We haven't been able to just say, you know, everyone show up from 10 to 2 at this location, given the pandemic and the importance of keeping people safe. We've honored the importance of that and will continue to do so as we go forward.
Just to if cities do this on their own for signups and so forth, are you going to oversee that? Are you going to scotch that? Is that an acceptable approach, do you think?
We will definitely be working closely with municipalities or all of those who are the vaccinators on our behalf.
Did you know Warwick was doing this separate press conference to announce that they were having these vaccines?
For the press conference itself, no, but our team is coordinating directly.
If I can just make Governor McKee, let's talk about the math, if you will.
Go ahead.
So clearly we're halfway through the fiscal year, and while sales tax collections have been surprisingly strong, perhaps in regards to the now Amazon tax, when you look at all the host of other published tax collections, they're dramatically off. Clearly we're not privy in the press directly to the rate of public income tax collections or corporate income tax collections. Number one, given your immersion in the COVID issue, obviously that's been your priority, but have you had an opportunity to have any type of incoming budget conference with the House, with the Department of Revenue, to understand where we are relative to the balance of the fiscal year, and to amplify an earlier asked question, is it time for shared sacrifice in the state? Will there be furloughs? Will there be budget cuts in what is clearly going to be potentially an off-the-cliff experience fiscally?
Well, all of above on those meetings you talked about with the Senate, the President, the budget, the revenue. And it's too early to answer the second question because we don't know what the stimulus is going to be. We don't know what those are. Certainly anticipating that the stimulus is going to be very aggressive based on a new president in Washington. So until you have those numbers, you're not going to speculate on those, on those outcomes, what you're going to have to do.
But ultimately, we're running into a situation which seems to be an annual event in Rhode Island, and where as we approach the end of the fiscal year, the ability to catch up to the math simply becomes on a day-to-day basis increasingly compressed. What's been astonishing to taxpayers throughout this entire experience has been the absence of any type of fiscal responsibility. It's not your fault, you're just assuming power now, but there's been no budget cuts, no furloughs, nothing, operating as if this were a normal year, and in fact, even net of the federal transfer payments, increased the budget. At what point does somebody put a brake on this?
Well, it's extraordinary times, it's not normal times, right? So we need to make sure that before we ask taxpayers to pay more or workers out there to pay, to have less, we got to see the numbers, and that's what we'll do. And I'll be happy to follow up, as I have with many of the reporters here, specifically on that. But we want to keep this on the COVID issues. On this press conference.
Will you, as governor, issue, and it was discussed earlier with Governor Raimondo, will you an edict, an executive order, eliminating some of the filing fees, the penalties, the fines, and all the death by 1,000 paper cuts that doing business in Rhode Island represents, particularly for businesses who can't legally operate right now?
I'd expect that and more.
On the local vaccinations, will people from one town, city or town, be able to get vaccinated in another town? And is there going to be checks making sure that everyone is from a particular town as this is happening on a community by community basis?
Our ultimate goal is to get the people at highest risk vaccinated as quickly and effectively as possible as soon as we have the supply. So there is going to be less focus on exactly where you live, and we're going to look to minimize how many barriers are in place once you qualify in terms of age, geography, or underlying conditions. We're going to want to support that, and we can from a state level because we are administering vaccines across all the municipalities.
Qualify by geography. Say you live in Providence, and that's up, and you are 25 or 30. Will you be able to be vaccinated while other communities are doing 65 and over?
The way the process will work is in those communities that are hardest hit, we will be accelerating vaccine availability. So if other communities are vaccinating 65 and older, you may have some of those more challenged communities in terms of COVID and hospitalizations and deaths at the point where they have enough to vaccinate 55 and older or 50 and older. So there won't be the type of gap that you described, and there will continue to be the focus on those who are at highest risk.
Dr.
Thanks,
Doctor, why is Warwick doing their vaccines in East Greenwich? Warwick is going to administer the vaccines in East Greenwich. Why is that? And is that then open to East Greenwich residents?
We'll get back to you on that detail.
One last question. I know that you have said there's only one governor at a time. Clearly that's going to be changing soon. I think a lot of people would like to know, and I get a lot of email, what do you think is going to be the one or two biggest differences between a Raimondo administration and a McKee administration?
Yeah, so I've been asked that a lot, and I basically say I'm not into comparisons. That's up to you to make those comparisons. You're going to see a governor that'll be in all 39 cities and towns, and working very hard to keep the economy going, keep the COVID issues under control, and the education moving forward.
Do you worry that there are going to be 39 different vaccination clinics without any state coordination?
I don't think they heard that.